Babu, when the UK and the United States started easing restrictions, by then they'd really been able to vaccinate a far bigger percentage of their population. In India, and I can go across once again to show you the latest vaccination data. In India, the number of people being vaccinated as a percentage of our overall population is still very minuscule, and the graph continues. If you see, this is the yellow line represents the total number of people vaccinated. It's 19 crores at this moment, but it's still a graph which is, you know, a downward facing graph. It's just begun to pick up over the last few days, but it's a graph that's generally coming down. And in the same way, if you look at the key states where vaccination is going on, it's far slower. Huge vaccine shortages still being reported. Therefore, what's your sense? Can we afford to start easing restrictions starting next Monday, even though we haven't been able to vaccinate too many people? Or would you rather hold on for a while till we're able to vaccinate more people and drag the lockdown till then? Giridhar Babu.
Yeah, so Rahul, I'll give my own realistic assessment. Let's look at the vaccine supplies. I don't think it's going to change till the end of July. So the vaccination pace can only increase from the beginning of August onwards. In my own sense, we have to cover at least 10 million doses per day to be at least confident of covering 300 million in a span of, ahead of the next wave. So that's the step number one. Step number two, how extensive is the lockdown now? We should be making decisions in terms of local evidence-based unlocking. And right now, it is a neighbor did the unlocking, so I'll do. And because I did, the next neighbor will also do unlocking. That won't work in a system like this. We need to be looking at the data very clearly, as Gautam pointed out. We need to be developing dashboards with scenarios from the real-time data to guide this process. And this decision has to be at the district and state level. The third most important thing, Rahul, is the whole purpose of lockdown is to just reduce the speed of transmission. If we are failing to detect the number of cases during the lockdown and contain them, we are actually allowing some kind of masked transmission going on. We don't know what is the impact the moment we unlock. So unless we increase testing levels in rural areas and in the areas where testing is not good, unless we ensure that the transmission is actually interrupted in all the areas, we can't be sure that after unlocking things will be...
No, one second. Can I ask you a direct question, Dr. Giridhar Babu? Are you suggesting that Monday would be too early to start lifting restrictions, that the current state of an extreme lockdown with very harsh restrictions should continue beyond next Monday, even when caseloads are coming down?
So let me answer this like this, Rahul. I don't think we should be taking a decision nationwide. This decision should be taken for each state based on the data there in terms of what is the overall test positivity, what kind of test are we doing.
So let me build on that question then. Which are the states where you'd feel comfortable lifting restrictions starting next Monday, and what are the kind of restrictions that you'd be comfortable easing?
Of all the states, I'm very comfortable about looking at the data from Tripura and Odisha. Odisha is a perfect example for consistently increasing the test per million. Their cases have been detected well. The death per million is going down. And the most important thing, there is correlation between higher vaccination coverage and lower death per million, which is what you just said before.
But what about Maharashtra, Delhi, Uttar Pradesh, some of the other states which have been locked down very severely, where also the caseload and the caseloads are coming down, the trend line is heading south?
I should also let Brahma, Gautam and Professor Maninder answer these questions because they're monitoring more states. But my own sense is that the testing is not uniform. The testing is mostly done in the capital cities and only in the urban areas.
Okay, so you voiced your reservations. I hear what you're saying.